Last week was the not State of the Union address, and in it, we were kind of promised that there'd be a replacement for Obamacare coming through, but it was going to offer better coverage, cover more people, and be cheaper. So hey, that's a win-win-win. Okay, I was all for that. I was like, all right, let's call it Trump Care. We'll have Medicare for all. We'll have socialized medicine, as they call it. We'll just call it Trump Care. Everybody will have access, and it'll be paid. That sounds great. But the plan came out this week, and that's not what's going to happen. So now they're going to get rid of the mandate, which requires you to have health insurance, or you pay a tax penalty. And it also deals with getting rid of Medicaid expansion, and instead of getting a tax and getting an incentive up front, we're going to get tax credits that are age-based rather than income-based, which means Bill Gates and my dad will both get the same tax credit because, hey, they're the same age, so they have the same need for a tax credit. And that's kind of where the problem lies, okay? So the way that the healthcare system works now is it's basically a tax for people. You have to have it. So in its current form, it acts as a regressive tax, meaning that if I make $40,000 a year and my insurance is $8,000 a year, insurance, healthcare, deductible premiums, all of it, that means I pay 20% of my income right off the top before taxes, or I guess with taxes, and before electric and water bills and internet. 20% goes right to healthcare costs. That are the most important costs, because it's not something you can just say, we're not going to do healthcare this year, because if you need healthcare, it's got to be paid. Otherwise, death, I guess. So that's not really a choice. Okay? But if the same $8,000 a year plan was for a guy making $400,000 a year, well, for him, that's only 2% of his income. So he's still got 98% of his income left for all his bills and his discretionary spending. A guy making $4 million a year with the same $8,000 a year plan is only going to have to come up with, he's going to have 99.8% of his income left for whatever he wants to spend it on. Then we got 6.2% taxes for the $40,000 a year guy. The other guys get a tax break there because they're going to hit the Social Security max. The point is that we are having a regressive system that punishes people who have lower incomes for something that's basically a tax. Because I don't care if I'm having to pay 20% to the government, or if I'm having to pay that 20% to the healthcare industry. If it's something that's required for me to live, that's a tax. But the problem is that the wealthier individuals, they're not going to look at it that way, because if you say, let's have nationalized healthcare, and we all get healthcare, and then we fund that with a tax, suddenly we can't pay for it. Even though right now we're all paying for healthcare, and somebody's paying for it, whether it's government, whether it's me, whether it's you, whether it's our employer, somebody's paying for it, and somehow we're getting by with it. But if it's national health care, we can't afford it. The reason is because with that you can raise tax rates. So you could always just raise tax rates, and you can make it progressive. That'll hit the wealthy, and that's not what they want to happen. What they want to happen is that it's going to hit lower income individuals at the same rate or worse, and it's going to affect them all the time worse, because if I spend 20% of my income to getting health care and health insurance, well, then I've only got 80% of my income left. Somebody's making $30,000, they're getting even less take-home income. And that's kind of the point, is we don't want that. We need to support those who make lower incomes and make it easier for them to get the health care that they couldn't afford otherwise. Because America is the greatest country in the world, if you're wealthy, to get health insurance. And I keep hearing how it's available for everybody. Everything's available to everybody in that sense. You know, we could have $1 million homes and Teslas and beautiful things, but if we can't afford them, it's not available to us.